Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Mohyuddin Mirza, your host for the program called Food for Thought. We have been getting good feedback from you on this program, and we are very fortunate that second time in our second program we have a very distinguished professor, Dr. Arya Sharma, who is an expert in obesity. In our last program we talked about what is obesity, what are the causes, we discussed about the food and digestion. And in this program we can focus on what can be done. And Dr. Sharma was mentioning there is a what we call Edmonton protocol. In case you don't know, Edmonton is in Alberta, Canada, and that's where we're making this program. Dr. Sharma, welcome again. So let's take back on, we had talked about obesity, and you have a Edmonton protocol.
Yeah, so it's the Edmonton obesity staging system.
Obesity staging system.
It's a staging system. So normally when we talk about obesity, we use the term BMI,
right? Yeah,
which is the body mass index, which is a measure of how big you are.
Right. Yeah.
So the higher your BMI, the more body fat you have.
Yeah.
But it doesn't tell us how sick you are.
Exactly. Exactly. Yeah.
And so the Edmonton obesity staging system is a way of defining of how the excess weight is affecting your health.
Okay.
And you can go from having excess weight but still being very healthy, stage 0, to having a complication like obesity or hypertension.
And this is your research which you did.
And this is the research which we have done, where we have said that in order to classify or stage obesity, that helps us as clinicians to decide who needs treatment, how much treatment, what type of treatment. And it's a better tool than just using your BMI.
Right. So is it widely adopted all over the world as well now?
Well, we published this as a scientific article last year. Currently we are doing work to establish the protocol. We have already introduced it in our healthcare system, so that the referrals to our clinic, for example, are now based on the Edmonton obesity staging system.
And there was a little bit of unfinished business in the last one. We were talking a little bit on the genetical factor. Of course, everything is genetic in human being based on the genes and DNAs and whatever. So have you found a link between genetics and obesity factors?
Well, as you say, most of the things that happen in our body are genetically regulated.
Right.
But there is also a lot of interplay between the genetic factors and the environmental factors.
Right.
And the way that I like to look at this is that the genetics loads the gun. But the environment pulls the trigger. So if you just have the genes, that is like having a loaded gun. But if there's no one pulling the trigger, then you don't have obesity. But if you take this loaded gun and put it in the wrong environment, then you get obesity.
But see, when we are talking about hunger and food, and of course, sometimes I wonder that we live for eating. Eating, of course, we need nutrition, we need energy, and eating is the major part. So it has to be some genetics. But I also was asking you the question that I have seen some people who are thin like a spindle, but when I look at their plate eating, I bet there's a 2,000 plus calories of sugar and proteins and everything. Any comment on such people?
Well, of course. We all know such people, and I call them the mutants. Because they are
not ninja mutant, but
not but they are different from other. Most people, when you eat too much, you put on weight. Now, these people have the capacity to actually increase their metabolism when they eat more, and they're not increasing their metabolism. Usually, they're increasing their activity. But they are not even aware that their activity is higher. It is unconscious activity. It is fidgeting. These are people fidgeting, they're moving their arms, they're tapping their feet, they're running around, they can't sit still, they're constantly moving faster than everybody else. And they can burn a lot of calories. And that protects them from putting on extra weight.
And on the other hand, I've seen some people who are, I know they're diabetic, I know they're obese, but they cannot control what they're eating. So I'd like to know a little bit more from your experience that what make us not to stop when food is there and we know we have a health condition?
So there's a couple of things there. The first one, as I mentioned in the last program, is that there are two systems that regulate food intake. One is the homeostatic system that is only about calories. If I don't eat, I get hungry, and I eat and I feel full, I stop eating. That's the homeostatic system.
But what you're telling me that something's going on in the mind and I'm eating.
Exactly, but there is a second system which is driven by pleasure.
Right,
and is more the addiction centers. And those centers are much more difficult to control.
Right, right.
So if I know that eating this food is going to make me feel good,
yeah.
or this food is very tasty,
right.
not eating it
yeah.
is a very big sacrifice.
Right, exactly.
Right? And it is the same whether you're doing this with drugs or
right.
alcohol or
right.
smoking.
Right. Yeah.
If you have an addiction,
yeah.
it is much more difficult to control.
Yeah.
It takes much more effort
yeah.
than simply saying I'm full and I'm done.
Right, right.
Right?
right.
And that is the problem with food, especially with tasty food.
Right, yeah.
Because it is designed
yeah.
to be pleasurable.
Right, yeah.
And it is very difficult when something is a source of pleasure
yeah. Yeah.
to avoid it or to stop.
And I have myself experienced that if I'm eating the food which I love, and if somebody points out that, oh, don't eat it, this is not good for you, I get offended. Is it normal? I mean that I take offense that I'm eating here and you're stopping me, but could that be a mechanism to stop eating?
Well, controlling your food intake is not a natural response. The natural response is to eat food when there's food available,
right.
to eat faster than everybody else, and to make sure that when you eat, you're going first for the calories.
Right, right.
Right? That is natural response. When I'm telling you,
right.
you can't do that,
yeah.
I'm actually telling you to do something that goes against your nature.
Yeah, yeah.
And that is why you get offended. And that is why it is so difficult to do.
And that's overall problem with you as well. When a patient come to you and you have determined their, the term you use, Edmonton
staging system.
Staging
yeah.
system. So how do you coach them?
Yeah.
Do
yeah.
they have to go to a psychologist? Or
well, see, and that is where obesity management becomes complicated.
Right,
because
exactly.
in the end, when you say somebody is gaining weight because they eat too much,
right, right.
and I say this person is eating too much,
right.
I'm only describing a behavior. I have not made a diagnosis.
Okay, okay.
The diagnosis is to find out why this person is eating too much. And that is where things become complicated. Because you could be eating too much because
right.
you're hungry all the time.
Okay.
You could be eating too much because you love food.
Right.
You could be eating too much because you're taking a medication for your diabetes or for something else that is making you hungry all the time.
Oh, so there is that possibility
Absolutely.
as well?
You could be eating because you have chronic pain, and eating food is your way of dealing with the pain.
Really?
You could be eating because there are psychological issues,
right.
emotional issues, psychological trauma that you might have even had years ago as a child.
Right, right.
And your way of dealing with that trauma is by eating. And in fact, we see, we see excessive eating sometimes as part of a post-traumatic stress syndrome.
Really, never realized that. Is that complicated?
Depression can make you eat. Attention deficit disorder,
right,
where you have lack of impulse control,
right, right,
can make you eat too much. So when I think that the weight problem is because somebody is eating too much,
right,
my
right.
job as a physician is to find out why this person is eating too much.
And can you easily do that? Or time consuming?
It may be a little bit of time consuming. That depends on how much experience you have and what the most common causes are. So I can tell you one of the most common causes of people eating too much is not eating.
What do you mean not eating? Irregular or?
Eating irregularly.
Really?
Because as we discussed in the last program, when eating when you're hungry means two things. You're going to make poor choices.
Right.
And you're going to eat too fast.
Right.
And that only happens when you're hungry.
So what is
not eating during the day, for example.
Right.
I mean, you can see this typically happening during Ramadan, for example, during the fast.
Right, yeah.
Where you go the whole day with no eating.
Yeah, yeah.
What happens when the food comes on the table?
Yeah.
You're starving.
Yeah, that's true.
What are you going to eat?
Right.
How fast are you going to eat and how much are you going to eat?
Yeah, yeah.
Well, you're going to eat more than you need. Why? Because you have not eaten the whole day.
Exactly, yeah.
And even outside of Ramadan, many of us make the same mistake. We don't have proper breakfast.
Right.
We don't have proper lunch.
Right.
We're too busy to eat during the day.
Right.
So we come home to the evening and we are hungry.
Right, right.
And now you're eating at the worst possible time.
So what you suggest is that eat something every 2 hours, 3 hours. What's the normal digestive cycle?
The important thing here is to not let yourself get hungry.
Okay, okay.
Right? And there are different strategies work for different people. For some people,
having
starting the day with a large breakfast.
Yeah.
So that you can easily go to lunch and then having a proper lunch.
Right, right, okay.
And then by the time you come home in the evening, you're not so hungry because you've already eaten so much during the day. You had big breakfast, you had big lunch. Now you can have a sensible dinner. And you eat your dinner and then you're done and then you go to sleep. if you don't have breakfast,
right,
and you don't have lunch, or
right,
you have a small lunch,
right,
well then, of course, you're going to be much hungrier when you come in the
yeah,
evening. You're
yeah,
going to have a large dinner,
yeah,
but even that large dinner is not enough.
not enough, yeah.
Because
yeah,
you still need calories. So even after dinner, before
Right.
going to bed, you will snack.
right, right.
And that is just a completely normal response of your body trying to get the calories it needs. And you will find that one of the key things that if somebody is not having breakfast
Right,
or is skipping meals,
right,
the best strategy for that person is to start having a proper breakfast,
okay,
start having proper lunch.
right,
If you can't make it from breakfast to lunch,
right,
either you introduce a small snack in between or
Right.
you increase the size of the
Right.
breakfast
right, right.
so that you can make it to the next meal. That is called hunger management,
Okay, so that's
or
one
actually
aspect of
hunger prevention, right? So in some people that is the cause, but now
Right.
there are other people who have breakfast and they have lunch and
Yeah.
they have dinner and still they're eating too much.
Exactly.
For them, the driver of eating may be something completely different.
Right,
Right? It
right.
could be all the other reasons that I mentioned,
Yeah.
medications they're on,
Yeah.
depression that they have, the fact that there are people pushing food on them.
Exactly, yeah,
Right?
yeah, yeah.
Those are all other reasons that can cause overeating. But the key to finding the solution to obesity treatment is
Right.
to find out what is driving the behavior. Right? So if you say somebody's eating too much,
Right.
the question is why is that person eating
And
too much?
your team, you consult with such people and try to find out
Absolutely.
the reason and then try
Yeah.
to correct that one.
Absolutely. And it's not just about eating too much, it can also not be moving enough.
Right.
Because the reasons that somebody is not moving can be psychological,
Yes, yeah,
can be lack of time,
yeah,
can be low energy
yeah,
levels,
yeah.
can be some other medical condition
Right,
like
right.
angina or asthma
yeah,
or
yeah,
back
yeah,
pain or knee
that's-
pain,
yeah.
or could be medications you're taking
Yeah.
that are making you drowsy, that are
Right.
making you have less energy. So
Right.
again, if I say somebody's not moving,
Yeah,
I have to then make the diagnosis, why do I think this person is not moving?
exactly, yeah, yeah.
And only if I understand why the person is not moving
Right,
can I offer a treatment, because the treatment will be very different.
yeah, yeah.
If your problem is not having enough time,
Right,
well then we have to talk about time management.
exactly, yeah, yeah.
If the
yeah.
problem is your back pain,
Yeah,
well then we have to talk about your back pain. So the treatment is going to be very different on
Exactly.
how do I get you moving.
exactly, yeah, yeah. A very remarkable thing. And you also brought up Ramadan. I know that it's coming again in August. It's come by lunar calendar. So I'm pretty excited and also scared as well that you have to fast for such a long time. But many times I've seen that because you are not going to eat, so you don't feel hungry at least major part of the day,
Sure.
but then your activity slows down sometime.
Yeah.
But at a young age, for example, I was able to work as well in the field as well and not feeling anything. But as you get older, like we're saying, your metabolism changes.
Yeah.
But going back to this, Ramadan is, of course, one aspect. But most of the religion have a very strong commandments about eating and drinking and food ethics and even morality of moral parts of food. For example,
Of course.
I know in Islam is ethically earned. And when you be thankful to God that the food is on the table.
Absolutely.
I have, my dad used to tell me that there was a saint, whenever food was presented to him, he will take a bite and think that, thank you God that it came from somewhere, got processed there. And so how do you view when you go and talk to people?
Yeah. Well, eating is a big part of culture.
Right.
Religious culture, but also secular culture.
Right, yeah, yeah.
Eating is a part of how you
Right.
communicate, how you interact with
Right.
people. And that is what makes it difficult.
Exactly.
Because not only in every religion is eating and not eating an important issue, but in
Exactly.
every social event that you have,
Absolutely,
even
yeah.
if they're not religious events,
Absolutely, yeah.
like birthdays, etc.,
Yeah.
you still have eating as part of that.
Right, right.
And there are belief systems, right? There are, in some cultures, you know, when a guest comes to your house, the first thing you do is you offer eat. If they
Exactly, yeah.
refuse the food,
Exactly.
you're offended, right?
Absolutely,
I mean,
yeah.
you
Absolutely.
cannot not
And then
accept the
somebody
food.
keep on pushing.
And then they keep pushing
Eat
you.
more, Dr. Sharma.
In some cultures, if you don't finish your plate, that is a sign of,
Absolutely.
you know, that is a bad sign. In some cultures, you finish your plate, that's not good,
Absolutely.
right? Because that means that you need more.
Yeah.
So there are a lot of these ethnic, you know, cultures and philosophies that go
Right,
into both
right.
the secular and religious field
Right, right.
that have a huge impact on
Yeah,
eating,
yeah,
because that's
right.
how we interact with our.
Yeah.
It's part of our social.
Exactly. Yeah.
It's how we bond to people.
Yeah. Yeah.
And unfortunately, today, where food is so omnipresent, it's there all the time, it's easy to get, it's very cheap, it's affordable.
Although your instinct is not gone, you still are gatherer, hunter.
You're still hunter-gatherer. The brains are still like they were 20,000 years ago, right? Same brain. Trying to do the same thing, but it's doing it in an environment which is very different.
Right, yeah. So, do you use this strategy? I mean, make people aware that these are the tools available?
Oh, absolutely. The first thing that you want to do is make people aware of what they're actually doing. And this is a basic principle of any chronic disease management. It's called self-monitoring. When you're diagnosed with diabetes, what does the doctor tell you to do? The doctor tells you to start measuring your blood sugar, start writing it down every day, start keeping a protocol. When you have high blood pressure, what does the doctor tell you? Get a blood pressure machine, start measuring your blood pressure, start writing it down. When you have asthma, what does the doctor say? He says, get one of those monitors and start blowing in there 3 times a day and start writing down the numbers. That is the principle of self-monitoring. And the same applies to obesity.
How would you do in obesity?
In obesity, the first thing you want to do is keep a food record.
Keep a food record. Write it down.
Write it down. If you write down what,
oh my God, that's a tough one.
Write down what you had for breakfast. Write down what you're eating for lunch. Write down what you're eating for supper.
And then look at nighttime.
You know what? Even if you never look at it again, the act of writing it, of having to write it down, will change your behavior.
Really.
And doing this, and then you look at it, and then you say, oh my God, I don't believe I ate that much, right? And so next time you eat, because you are going to have to write it down, you're going to change your behavior.
Really?
And when you look at this again, I can look at a food diary and I can say, you know what, I can see lots of meat, but I don't see any vegetables. Maybe you have to start increasing that, and so then you start writing that down. And so it's the act, it's that conscious, it's making something that is unconscious conscious. And
by writing it down, that's what you're doing.
By writing it down. And there are many ways of doing this. Some people, they just put tick marks. Some people will email me Excel spreadsheets. Right. So there's a lot of heterogeneity of how people do it. But the principle is the same. So if you're trying to control your weight, and you can go to any weight loss programs, most programs will tell you that you need to keep a diary. Because it works. Just the act of keeping a diary will make you more aware of what is you're eating, how much you're eating, at what times you're eating, when you're hungry, when you're not hungry. You can actually write those things down. The second thing you want to also write down, because that's the other part of the equation, is your activity levels. So so if you did 1 hour of sports, write it down. How many hours did you do? What did you do? How much did you do? Walking, for example, is a very easy form of exercise that anybody can do. And so a very simple tool is actually to wear a pedometer, which counts your steps. So at the end of every day, you look on the pedometer and you say, today I went 7,000 steps. Put it in your diary. And just the act of doing that changes behavior. And then, of course, because you're talking about weight, you need to monitor your weight. Not every day, not several times a day, doesn't change that fast. But at least once a week, and definitely once a month, you want to get on the scale. So and you want to
that's not only for obese people, that's for even for healthy weight management.
That's even for prevention of weight gain.
Writing it down is a good idea.
And so the first principle of treatment is self-monitoring. And self-monitoring for obesity means keeping a food diary, keeping an activity log, and getting regular weights.
So what could be the strategy if somebody is taking steroids, for example? They're very commonly used now in a different disease condition.
So when you talk about steroids, you're talking about medications.
Exactly.
And there are unfortunately many medications where the side effect can be weight gain. So steroids, medications that you take for diabetes, some medications for high blood pressure, some medications that you might take for depression or anxiety disorder. A lot of these medications can cause weight gain. If you need those medications because they are beneficial, then it becomes doubly important to watch your weight, which means definitely when you're starting a medication that is going to cause weight gain, right from the start, you should probably start keeping a food diary. You should probably write down how many minutes of exercise you do every day. And if you're finding that your appetite is getting too big because of the medication, you should talk to your doctor about it and tell your doctor, you know what, since starting the medication, my weight is going up, I'm hungry all the time, is there not something else I can do? And fortunately, for many drugs, there are similar drugs that have less of a weight gain side effect.
Oh, so some alternatives are available.
So some alternative, fortunately for many drugs, are available. So if you get started on a drug that is clearly causing you to eat more because you're hungry all the time and because your appetite is increased and your weight is going up, you should talk to your doctor about it.
Right. Yeah.
Or talk to your pharmacist about it.
Right, exactly, yeah, yeah.
And say, you know what, this drug is causing me to gain weight. Is there not something else I can take?
That's true, yeah, yeah. During our discussion, you also mentioned that the way our brain part, which is involved with the hunger and food, is also involved with addictions generally as well.
Yeah.
Can you expand a little bit? I'm
absolutely.
very curious because...
So food gives you pleasure.
Right, yeah.
Right?
Yeah.
I mean, certain foods give you pleasure. Some foods you may not like, okay? But the foods that you like give you pleasure.
Right.
Now, the pleasure center in your brains.
Right.
So we talk, if you use the technical term, you're talking about the mesolimbic system, the limbic system of the brain.
Right. So is it left or right? Or
well, it's actually quite deep inside your brain. Those are the same centers that get stimulated by things that cause pleasure. Right?
Pleasure means feeling of relaxation,
feeling of
euphoria.
You're feeling euphoria, you're feeling
relaxed and what.
Those are the same places that are stimulated by drugs, that are stimulated by alcohol, that are stimulated by cigarette smoking, that can be stimulated by some people with gambling.
Really?
And any addictive behavior is an addiction because you enjoy it.
Right.
And because doing it while you're doing it makes you feel good.
Right.
Now afterwards you may not feel good.
Exactly.
And you might regret it, but while you're doing it, it makes you feel good.
Right.
And if you have not done it for a while, you get drawn to that activity because again you're seeking that that enjoyment and that euphoria, that stimulus. And foods are the same.
Really?
Right? Because those foods will chemically do the same thing in your brain as those other things. And we know this because when you do imaging studies, so when you take somebody and you can put them in an MRI machine where you can look at the brain and you can do special studies where you can actually see which parts of the brain are active. And when you take somebody and put them in a machine and you show them pictures of their favorite food, it's the same part of the brain that lights up as when you show them a cigarette or when you show them other things that can make them addictive. And so we know that that for some people food is an addiction.
Right.
And the treatment strategy for them is the same strategy that you would use for any kind of addiction treatment.
I know you are an obesity expert, but I always had this question that I see some people who never like to eat, or their calories are so reduced, they eat at random or something. Have you run into, is that an opposite of obesity, or what would you call it?
Well, there are people who consciously restrict their calories.
No, but I'm talking
about dieting all the time, and actually anorexia, they're avoiding calories.
Right. Yeah. Okay. That's the term.
That you see, but there are some people for whom they don't have a big interest in food. They don't have a lot of pleasure in eating. They just eat when they have to eat, and when they're hungry they eat, and when they're full they stop eating, and there's not a lot of pleasure attached to it.
Right.
And you see that, but that is, and you see that with other things like drugs and alcohol. Some people are very prone to abusing those substances, and other people, they drink and they smoke, but if you have to stop tomorrow, you stop.
Right.
I mean, there's no problem. And so you see those differences between people, and it's the same thing with foods. I mean, I have patients who come, they say, doctor, tell me what not to eat and I will give it up tomorrow. And they can actually do that.
Really?
And I'm surprised that they do it, but they do it. Right? Other people, they say, you know what, you can take away all the other stuff, but don't take away this food.
Don't take my favorite food away.
Don't take away my favorite food. Everything else I'll give up. Right? So people are very different, and that is part of this treatment, that you have to understand what is driving the problem to really solve it. I cannot solve obesity by giving people, here's a diet plan that everybody should follow, or here's the Dr. Sharma program, which if you join, the special Dr. Sharma diet that everybody can do. There is no such thing, because the treatment for every patient is going to look different.
Differently. So the question also comes on obesity and diseases, and of course you talked about it, but expand a little bit for me on if a person is consistently obese, then of course you mentioned diabetes could be one.
Yeah.
And then all sort of other problems could come.
Well, I like to look at them. So when I talk about the complications of obesity, I like to talk about the 4 M's.
Okay. 4 M's.
4 M's.
Okay.
The first one, as you have mentioned, is metabolic disease.
Okay. All right.
Metabolic disease is diabetes.
Right.
High blood pressure.
Right.
Fatty liver disease.
Okay.
high cholesterol, etc. Those are the metabolic complications of obesity. But then there are also the mechanical complications of obesity. That is the second M. The mechanical complications are pains in your back, pains in your joint, not being able to breathe while you're asleep, so sleep apnea.
Just because of obesity.
Reflux disease. It's the size of your body that is causing the problem, right? So those are the mechanical complications of obesity. But then there are also the mental health complications of obesity. So being obese can make you more depressed, can affect your self-esteem, your body image, can cause anxiety, can cause all kinds of issues. So those are the mental health complications of obesity. And guess what the fourth M is?
My name?
Money. Money. Because those are the financial complications of being obese. Because we know that ultimately, being obese is going to cost you.
Exactly, you can't
It's going to cost your health,
that's true,
but it might also cost you income. It may affect your ability to look after your family. And it is also expensive to be obese. You may not get health insurance. Right?
Health insurance can be denied?
It can be denied because if you're obese, then you're a high risk.
Really?
Right? So those are the complications of obesity. So ultimately, most people, excess weight is going to affect at least one of those four dimensions.
And is that enough to convince people to start towards the curative process and eating less and everything we've talked about? Is that enough to, when you've mentioned the 4 M's?
Not usually. And there's a gender difference here. Women are very concerned about their weight. So I have no problem filling my clinic with a lot of women who want to lose weight. No problem. The men are more difficult. The men who come to our clinic with excess weight only come when they have a real problem like back pain, heart attacks, high blood pressure, diabetes. Then they come to us. Before that, you never see them. And that is a bit of a problem because the longer you're obese and the more obese you are, and when obesity has already affected your health, it actually becomes more difficult to treat than when you catch it at an earlier age.
And did you mention that you specialize in obesity and cardiovascular diseases as well? So that's just one disease you mentioned. But diabetes. But is it possible that if they come to you in an early stage when it's just starting, then you could help them a lot?
See, prevention is always easier than treatment. It is much easier for me to prevent you from gaining 50 pounds than it is for me to get you to lose 50 pounds.
Exactly, that's right.
If you want to come to me and say, doctor, how can I not gain 50 pounds? I can give you a lot of helpful advice. If you come to me and ask me, okay, so how can I lose 50 pounds? Well, now we've got a problem.
But your point is well taken, that I feel the same way, that men are different than women, and men generally, I will always like to feel that nothing will happen to me. Like an accident happened to other people, not to me.
I say like a kid.
Exactly. So how do you tell people? You hand them to a psychologist?
You know what? Very often, it's the I was saying only few men come to the program. Most of those men are brought by their wives.
Exactly. I think that's what happened. Dr. Sharma, thank you very much again. It has been fantastic to talk to you, and we read daily things in the paper. As a matter of fact, I don't know your article, somebody that the children, when you push them, mom push them, you don't eat. I think you had some comment there as well. So your blog, quickly, if people want to go to your blog, just type your name.
Well, if you just Google Dr. Sharma and obesity, it'll come up as number 1.
Excellent. Boy, that's something fantastic. So we have learned a lot of things from Dr. Arya Sharma, and hopefully you got few points to manage obesity. Don't be afraid to go to the doctor and consult it. Food, of course, has a big role, and the way Dr. Sharma has described the psychological aspect, what to eat, hopefully you could pick up few things from there. Thank you very much. This is program Food for Thought. I am Mohyuddin Mirza, your host. Assalamu alaikum wa rahmatullahi wa barakatuh.